What would you do if your loved one collapsed right in front of you? Would you know how to respond? Call 911, shout for help, or bring it yourself. In the U.S., emergency rooms over 136 million patients annually, and about 30% of those visits are related to injuries, according to the CDC. If you've ever been curious about just how many patients your local emergency room cares for, you're in luck. Join me as I dig deeply into the emergency room actual scenario and uncover the mysteries that the general public is unaware of. In this video, you'll discover the real secrets of emergency medicine and how it differs from what you might see on TV. Misconceptions abound regarding emergency care and the kinds of situations that physicians treat on a regular basis. This false belief is sometimes caused by the way emergency rooms are portrayed in television programs and motion pictures, when doctors are viewed as superheroes with instantaneous cures. But the reality is far from it. In real life, emergency rooms are chaotic, noisy, and unpredictable. Doctors have to make life or death decisions in a matter of seconds, and there's no script or rehearsal involved. The stakes are high, and the pressure is immense. One wrong move, and a patient's life could be on the line. The emergency room, ER, operates in a fast-paced environment where staff may see up to 200 patients a day, each with varying levels of severity and complexity. ERs also handle a diverse array of cases, ranging from trauma and acute illnesses to minor injuries and mental health crises, with approximately 10% of visits being for non-urgent issues. All ER patients are not treated in order of arrival. It is not a first-come, first-served basis. It is not based on race, color, and rank in society. To manage this influx, ERs utilize a triage system that prioritizes patients based on the urgency of their conditions, or the process of quickly examining patients or problems to decide which ones are the most serious and must be dealt with first. For instance, someone with a sprained hand may have to wait longer than a patient with a life-threatening injury like a stab wound on the abdomen. The emergency room, ER, can be an intimidating place, especially for first-time visitors who may be burdened with numerous myths and questions regarding the process. Let me give you some ideas or hints about what you are going to expect during your visit in your local emergency room. Understanding the workings of an ER and staff can significantly alleviate anxiety and improve the overall experience. First of all, do not be intimidated if you are not catered first. Everybody is entitled to be seen and given the desired care and treatment. Whether you arrive by ambulance or walk into the ED, staff immediate assessment of your condition determines who needs to be seen first. Although we never want anyone to wait, there are situations when it is unavoidable due to the urgent needs of other patients. Upon arrival, after a brief assessment, a triage nurse will classify patients as urgent, semi-urgent, or non-urgent cases. Patients who need immediate life-saving intervention are treated first. A fact: not all the time you'll always see a doctor in the ER. In some cases, a nurse practitioner or physician's assistant who is capable of carrying out many of the same tasks as a doctor may treat you in many circumstances. Many of the duties that PAs and NPs carry out in tandem with doctors include physical examinations, ordering and interpreting tests, prescribing medications, carrying out simple bedside procedures, and consulting with the appropriate specialists. Other providers like respiratory therapists may assist in managing airway and breathing problems. Mental health professionals. Depending on the situation, social workers or psychologists may be involved to address any psychological trauma. Radiology technicians, professionals who perform imaging tests to help diagnose injuries. Nurses, emergency room nurses who are trained to handle trauma cases, provide care, and administer medications. Lastly, social workers or case managers. They may be involved to help with the discharge process or coordinate follow-up care, especially in complex cases. ERs are equipped with advanced technologies in medicine such as X-ray, computed scan, magnetic resonance imaging scan, defibrillators, ventilator, Alaris pumps, and ECG machine. Let me talk about these equipment in case you encounter them in ER. To create images of the body, its organs, and other internal structures for diagnostic reasons, external radiation is used to create X-rays. An image known as a negative is created when X-rays penetrate body structures and land on specially treated plates or digital media. The more solid a structure is, the whiter it looks on the film. Conventional X-rays are taken for several purposes, such as identifying malignancies or fractures. A CT scan uses a narrow X-ray beam to take pictures of the body from different angles. The images are then used to create 3D views of the body's organs and tissues. A number of illnesses, such as brain hemorrhages, lung disorders, circulatory system ailments, and bone fractures, can be diagnosed by CT scans. What to expect when your health practitioner ordered this scan? Before the scan, you might be injected with a dye on an intravenous line, and you lie on a table that slides into the CT scanner. Technologist will command to stay still and occasionally hold your breath while the scan is taken. Magnetic resonance imaging, MRI, is a non-invasive medical imaging technique that uses radio waves and strong magnetic fields to create detailed pictures of the inside of the body. What to expect when your health practitioner ordered this scan? Before your MRI, you should tell your doctor if you are pregnant. Have metal in your body, such as from a shrapnel or bullet injury, or if you are a welder. Have metal or electronic devices in your body, such as a cardiac pacemaker or a metal artificial joint. Strong magnetic fields can affect the pacemaker settings, leading to heart rate arrhythmias. Some MRIs use a contrast agent, such as gadolinium, to make certain tissues and blood vessels show up more clearly. The contrast agent can cause side effects like nausea, rash, headache, or dizziness. During an MRI, you lie on a table that slides into a large tunnel-shaped machine. The scan is painless, but it can be noisy, so you might be given earplugs. You'll need to stay very still, as movement can affect the quality of the scan. A ventilator, sometimes called a mechanical ventilator, is a machine that helps you breathe when you're sick, injured, or sedated for an operation. It pumps oxygen-rich air into your lungs. It also helps you breathe out carbon dioxide, a harmful waste gas your body needs to get rid of. In addition, when a patient came severely sick and the triage nurse classified it as an urgent, expect that all healthcare professionals will come and see the patient. Not to say hi or how are doing, but to give priority care because life is at stake. Nurses start to insert intravenous lines, phlebotomists eager to stick and draw blood from the patient. Doctors will assess, order laboratory and imaging tests. Most of all, they plan the treatment of care. A respiratory therapist comes and assesses your breathing if you need a life support breathing machine. The social case manager will come and talk to patient relatives to ask about identification cards, insurance cards, and other social needs that need to be taken care of. A fact: expect that when you come to the ER, it is not like you pass by a to-go alley or a walk in the park that will just take a couple of minutes. Nope! Expect that it is a waiting game. Sometimes it takes 3 to 6 hours to stay in ED, whether the doctor wants to admit you for observation or discharge and send you home. The big question is, why does it take so long? Depending on your symptoms, a variety of tests may be performed, including blood tests, imaging studies like CT scans or MRIs, or EKGs. This comprehensive approach helps medical professionals diagnose conditions quickly and accurately, guiding the treatment plan effectively. Your health provider sees to it that you receive the proper treatment and best diagnostic test. When all those medications were given, problems are addressed, and no reaction and result from all diagnostic came with result. And the results are promising, or if the results need an intervention, that is the time healthcare professional decides if a patient needs further treatment or monitoring. Moreover, some tips and attitudes that we need in ER. Clear and honest communication is needed coming from the patient or to someone who knows the patient, especially during history assessment of present complaints of the problem. Denying and lying will lead to treatment delay. Patients should be proactive about sharing their medical history and their allergies. Take, for example, coming to the emergency department on a drug overdose and denying the name of illicit drug. Then, practitioners do not want to guess, so tests are taken, and this will take time, delays to affect outcomes. You have the right to refuse care and treatment. Have an open-mindedness, be receptive to different treatment options and medical advice. Bring a pound of patience too, because ER staff are overwhelmed with patients' jobs, and the paperwork's too. Sometimes the environment in ER can be busy and can compromise your privacy. As you navigate the ER, safeguarding your valuables is also crucial. Although many hospitals provide secure areas for personal belongings, it's wise to keep valuables at home or with a trusted companion, as the ER can be a hectic environment. Another is, if your primary nurse tells you not to drink or do not stand up after giving medication, they mean it. Some medication can cause dizziness. If they tell you not to drink or eat, they are preparing you for a diagnostic test, which needs your care. You'll also learn about the emotional toll that working in the emergency room has on physicians. It can be extremely taxing for them to witness sorrow, loss, and suffering on a regular basis. In order to cope with the trauma they see, they must learn coping strategies, and burnout or compassion fatigue are frequent outcomes. The greatest surprise you'll have is how much of the work involves talking and interacting with patients, rather than merely performing medical procedures. Emergency room physicians and nurses need to be able to swiftly create rapport, gain patients' trust, and engage on a personal level. Even in the most chaotic of circumstances, they must be understanding, sympathetic, and kind. By being prepared, knowing what to expect, and communicating openly with the medical staff, patients can navigate their ER visit with greater ease and confidence. It's a place designed for emergent care, staffed with skilled professionals who are dedicated to helping you in your time of need, ensuring that you receive the best possible treatment in a challenging situation. If you found this video insightful, check out our other videos and share your thoughts in the comments below.